With me right now from 7 Day Dental is Dr. Christine Chung and Dr. Chuck Lee. Great to have you back. Happy New Year to you.
Good
Happy
morning.
New Year.
Happy New
Yes,
Year.
and we're saying Happy New Year. We haven't seen him so far this year, so Happy New Year to you. And Happy Valentine's Day coming up, I guess, too. So what we want to talk about is just in general, you know, why people go to the dentist. You know, they might be doing all right and you know, don't have any really problems and all. But especially as you get a little bit older, you might have dentures. You might have some problems that just due to getting a bit older that years ago you didn't have to worry about too much, like anything else,
Yes.
like your hearing, like your eyesight, like
Yeah.
just about everything.
So the common thinking is that I don't have pain. I don't need to go to the dentist. And we can't stress the important thing enough that regular checkup, we set out 6 months as a standard time to go see your dentist for a regular checkup so we can detect any gum disease, dental decay, and then now oral cancer. We screen oral cancer annually.
Okay.
The American Society of Cancer recommends that every patient should be screened annually for early detection of oral cancer.
Okay. And what do you do to screen that? Is it just visual, or is there something else that you do?
We do a visual, and if we suspect anything, there's more things that we can do. We can
Okay.
do use a light. We can use the light. We can do. There's many ways, but the first thing is, I think we all feel like, in the medical field, like, hey, I'm not sick, I'm fine. I don't need to go to a medical doctor. I think in dentistry it's a little different because gum disease is a silent disease. It doesn't show up and it doesn't manifest itself until it's really bad. And so the first thing that I think a lot of people miss is the gum disease.
Okay.
The gum disease. So when patients come in, we do a thorough screening because gum disease is being that you don't spot it on really early. So we measure the gum, we measure the pockets. We want to make sure the pockets are minimal, and if we see inflammation or any bleeding, we're going to we may recommend
Okay.
deep cleaning more than that.
All right. And another thing you want to mention is dry mouth.
Yes.
And, you know, we all get that now and then, but I understand that it can be chronic for some folks. It can be caused by medication or,
Yes.
or maybe a symptom of something else that could
Yes.
be going on.
Yes.
Quite often, diseases like Sjogren's and others, the first sign are dry mouth, dry eyes.
Yes.
Yes.
Yeah.
And on the Sjogren, that's a different story. But usually, I feel that patients they're fine. They don't have any medical issue, but maybe it's a little high blood pressure, maybe it's high cholesterol, and they're on medicine daily.
Right.
And what happened is when they have dry mouth, it doesn't affect like overnight. It's a slow progress. And so you think that, oh, it's normal, I'm getting dry mouth. You're not seeing a drastic, like a night, huge difference. So what I always tell patients is, if you're taking medicine, let us know, because some medicine can affect everybody differently. And one of the side effects is dry mouth. And we have dry mouth. I usually tell patients to, one, brush longer, because when you have dry mouth, you're going to get accumulation of food around the gum.
Okay.
And around the teeth a lot more than you did before. So if we're brushing the same amount of time as we did 20, 30 years ago, we may not be removing enough. So we have
Okay.
to spend more time. And the second thing I also tell patients is sometimes we may recommend supplements, such as extra fluoride, to strengthen the teeth, because now there's more accumulation of plaque and food. So that will help them fight the dry mouth. And they may be on, we may recommend some different rinses, or just letting them know And a lot of time they can probably go to the medical doctor and maybe switch medicine.
Okay.
And that, will lessen the dry mouth.
All right.
And in addition, we also recommend more frequent dental visits.
Okay.
So we can do more cleaning per year.
The rinses you talk about, are those the over-the-counter ones?
They have over-the-counter. It's just, like I
The
said,
fluoride
everybody's
rinse and that
different.
sort of thing?
Yeah.
Okay.
We want to make sure we customize each patient to what they
Okay.
need.
So it might be different for
Yes.
each person.
So if it's not minor, over-the-counter is fine, but it's more advanced, and maybe we want to have them do a medicated rinse.
Right.
Where we write a prescription.
Okay, all right. Now, what about just in general? People, maybe, they're fine, not any real problems, but they just want to look a little bit better.
Yeah. So I
We
think,
can talk about smile rejuvenation. We
as
have some slideshows. Oh
Yeah.
yeah, talk about that. There's that slideshow right there.
we see a lot of patients that we hit after 40. I think it's kind of like a car. If your car you've been driving it for so many years, you may need a new paint job,
Right.
or just maybe a new car.
Yeah.
So in teeth, as we age, we're clenching, we're grinding the teeth, we're wearing down the teeth just from normal wear and tear, from eating, from all the years of sports and all
Yeah,
that. You
yeah.
may have chipped some teeth or cracked some teeth, or some patients love to chew ice when they're younger, so they have cracks in them. So we're recommending that as we age, we get gum recession. So with gum recession, you get a lot more open space in your gums, and doing smile rejuvenation such as porcelain veneers or aesthetic bonding can close up those gaps to make you look
Okay.
younger.
All right.
Or even remove old fillings. Some patients have old fillings for years, and they tend to wear down and crack around. And most of the time, amazingly, when we remove those old fillings, you can see recurrent decay underneath there.
Okay.
Yeah, so sometimes you cannot detect on the X-ray because they are small.
Yeah, yeah.
So by checking the patient's mouth, if we see some fillings that are old and could have the crack lines, we would recommend to remove them. And especially it's the old silver fillings that we replace with the new technique. The color, tooth color, or
Bonding.
resin,
Yeah.
resin or porcelain.
Okay.
Yeah.
And that is done like you said, it could be a couple of reasons, for aesthetics, or there could be a problem with that.
Yes.
All right.
Yeah, usually if the filling is cracked, we want to remove the filling and make the tooth stronger by putting a new filling and bond it to the tooth, and that will strengthen the teeth.
Okay. When you do something like that, how long is that? Just a few hours to do that, or do you have to first take out the filling and
Yeah.
you just fill it in, or you need to do a mold first, or it depends on what happens to the tooth?
Very good question. So when we do that, there's a direct and indirect. Direct means if you have a small fillings, we can just do within an hour or two in office. But if it requires a crown, partial crowns,
Okay.
inlays, onlays, veneers, then it requires most likely it's 2 visits. Because we have
Okay.
to send to the lab. You have a temporary to go home that one day and then come back
Okay.
the second visit.
All right.
When the lab already fabricate your custom crowns.
Okay. Yeah, I was kind of
Or
wondering if that
fillings.
would.
Or fillings,
But
yeah.
that's obviously if there's more than just.
Yes, so every
Okay.
case is different. Yeah.
What about just in general, as far as, like you just said, rejuvenating your smile? And, nothing else is really wrong, and people just want to look a little bit better. I know you have different techniques for
Well,
that.
the first thing is to whiten your teeth.
Yeah.
You will see how much younger you look by have whiter teeth. And that's just the most conservative way. If there's nothing wrong with your teeth,
Okay.
whiten them. And I would recommend, even you have white teeth, you can maintain the whiteness because of your eating habits. I drink a lot of coffee and tea, so I use my bleaching almost on a weekly basis just to remove those stains. And,
Okay.
Yeah.
And when you have that done, I know you've talked about this before, there's different levels. In other words, you want your teeth to still look natural. So there's different levels of whiteness. Maybe you take it to a certain point and then, they can figure out that's good for me. And then now it's just maintaining that.
So we do have in-office?
Yes.
And
we
take
do
home?
the in-office
Yeah.
and the take-home. And the funny thing is, sometimes just a quick polish, a cleaning and a polish will whiten at least 1 to 2 shades.
Okay.
Yeah, so a lot of patients, sometimes they come in, they're like, they're at home, they're brushing really hard, trying to whiten their teeth. And they think that because their teeth are yellow, they have to brush harder, and they're doing more damage. And, so I think sometimes when they go to the dentist and they see our hygienist, we're able to clean and polish and rejuvenate them.
Right. And haven't you always said when it comes to a toothbrush, you really want a soft one, irregardless of...
Yes.
Yeah.
You want to brush it very gently.
Yeah. You don't need to be...
Yes.
Okay.
Yeah, because you're going to do more damage if you brush hard.
Yeah.
You actually do more damage, especially as our gum recede.
Interesting. Okay. And the usual flossing?
Yes.
Okay.
Yeah, make sure brushing and flossing go together. Yeah.
Let me ask you about something like that. Just, you got all these different brands of floss out there, and not, whatever brand it may be, but you do have the really cheap ones, and I know you buy the little the ones that are on the stick and all that, which makes things a little bit easier. But I know, I don't know, a few weeks back, I was getting them for my daughter. We were at Target, and you could see the really cheap ones. And I go, you know what? As soon as you put those in, those are going to snap. And now you got floss stuck, and spend more and get something that's whatever brand it is, but it's going to be a little bit more useful.
For flossing, I recommend the waxed.
Okay.
And exactly what you said. I buy the green ones.
Yeah.
They're Glide.
Yeah, that's what we have at home. Okay.
Yeah. Glide actually, Glide breaks easier than the unwaxed.
Oh, really?
Yes, the unwaxed, it will last you longer, but if the floss is not waxed, I think if you don't do it right, you can hurt your gum more.
Yeah.
Because it's so hard.
Yeah.
And,
but that's what we use. We use that brand.
Yeah, Glide is the best, and it's exactly like the name. It glides in.
Yeah.
It slides into the gum. So.
And just a little trick, your teeth are kind of like moon shape, C shape. So when you floss, kind of wrap around instead of just go straight up and down. You'll be able to remove more if you kind of wrap around like a C shape.
Okay.
As I tell patients all the time when I educate them about brushing and flossing, that's little tips really helped.
All right.
But February is the Dental Month Awareness. We would like to invite you all to come in for a free consultation.
Great.
And if there's need to have any treatment, we always offer 20% right across for our residents here. And at home, if you want to, you can do, self-test. Just kind of feel yourself for any kind of lumps or bumps. And if there's any suspicions, come on in. We do more of the screening detection for oral cancer. And if we find anything that's very unusual, we send out for a biopsy. Because early detection is very, very important in oral health.
That's true.
Thank you very much. Did you want to add something? You look like you're going to say something.
If you brush your teeth or floss your teeth, and when you spit out a little bit of blood, come in and see us right away.
Okay. All right.
That's an early sign right away.
Very good. Good to see you.
Thank
Doctors,
you so
thank you.
much.
Take care. All right, we'll be right back.